Now, as we saw, there are 9 abstracts we read and we heard in this. 3 were belonging to the biopsy, and one was the trial, actually, one of the early diagnosis, and others were radiotherapy as a therapy. Now, what I saw, what I observed is, as far as the one of the article was that using PSMA, I mean, it's interesting that can you start treating on PSMA itself and get away without biopsy? That's an interesting, and that will go food for thought. What they commented was that it is more than SUV. SUV 3.5 to 7.5 is always a doubtful. Now, whereas these guys are coming out with 8.5. No, 8.5 so already we have accepted. There's no question about that. Now, my worry is when to ask for biopsy on a PSMA between 3.5 and 7.5. So that needs to be addressed. Regarding the trial, I do not know what is the safe PSA value and when to do MRI. I mean, I'm confused at this point. 1.5 also you are doing MRI and trying to find out pyrite 2 lesion, and which is pyrite 3 2 biopsy. That's the question. Really adding to that. As far as the SBRT, of course, there is going to be. No, one of the abstracts which I saw was SBRT plus we are almost treating with doublet, which is like HSPC M1. So are we now believing that all node positive patients, whatever level they are, should be treated like HSPC? These are my observations today. Thank you very much.
Good morning. Regarding the radiation papers, there is a extreme hyperfractionation, moderate hyperfraction, and standard fractionation. I think SBRT in the high risk it looks as a bit dubious, because SBRT in low risk and favorable intermediate risk looks quite reasonable, but in high risk cases it may not be sounds good. And second thing is the radiation reactions, which has been shown that extreme hypofractionation, definitely in the high risk cases, there's a high radiation reactions in those patients. Because when you take care of the nodes, definitely we can take the higher area of the volume of radiation, and that can increase in the radiation toxicity. And till date, there is no clear-cut difference between the surgery versus radiation therapy, as it's been published in the various trials in the earlier, that the centers which are doing the more than 10 surgeries versus less than 10 surgeries, and then different in the outcome. So urinary dribbling is the main problem with the surgery, while radiation has itself complications, right? The radiation proctitis, it is a very difficult to control. Thank you.
Thank you, sir. I'll just make comments on few papers and real-world experience which we have. First paper was transperineal versus transrectal, and there's no difference in infection. But if you go for real-world experience, we have seen, even everybody of us has experienced that transrectal, when the infection occurs, this is a very bad thing for patients. There had been reported that there has been a pulmonary embolism because of the DVT occurred in the iliac veins, and patient died after transrectal biopsy. The advantage of transperineal biopsy, which was not mentioned, and that because it was not the topic, is that you can take patient for surgery any time of the biopsy. You need not to wait for 3 weeks or 4 weeks. The MRI and PSMA PET scan, which Dr. Kulkarni has already said about, only thing which I'll say that there are few reports in literature from Italy that people have done radical prostatectomy with MRI and PSMA positive without doing biopsy, and all 8 or 10 cases were having cancer. In practice, I have done 2 cases because patients refused biopsy. They said, we will not sue you. I got in writing 2 cases, and they both had cancer on MRI and PSMA without biopsy. Coming to the radiotherapy, Dr. Neeraj has already said, I think the best is to compare the best radiotherapist and best surgeon also when you compare the data. And radiotherapy is further evolving into reducing the time of the duration of the radiation, and also increasing the efficacy with that, also reducing the toxicity. I wonder that in future, they probably will compare all the radiotherapy versus the proton therapy when they say there is no side effects of proton therapy. Thank you.